Hello, Bundibugyo team. This is Dr. Mike, and I'm glad to be talking to you again today. Today I want to talk a little bit about osteoarthritis and timing of medication, which I think will definitely help you if you understand about how to work with the patients that you're seeing with that condition. So let's jump right in and get started. Osteoarthritis is a chronic condition which oftentimes comes in the older patients and also affects many different joints. Some of the joints that might affect would be the neck, the low back, the fingers, the knees, even the toes and the hips. In this picture of the lower spine, you can see how the disc spaces become narrower and there are spurs that develop on the vertebral bodies from osteoarthritis. This next picture shows how the spinal column can actually be narrowed by osteoarthritis and begin to pinch on the spinal cord itself, depicted in blue. This picture shows a lateral view, MRI of the lower spine, and you can see the spurs developing off the vertebral bodies. This picture of a knee joint shows a change from normal to the knee joint being spurred and thinning of the cartilage, which is typical of osteoarthritis. So I'd like to talk now a little bit about how we would treat these patients with osteoarthritis. What medications can we use to help these people? One possibility is to use a medication which is given PRN. PRN is a Latin phrase which means to take as needed. It's a strategy that I would really like to recommend against you using. Let me explain why. Here is a pain curve which describes a patient's pain. If you look at the green line, their pain begins to rise and then hits a peak, at which point they take some medication and the pain goes down. But if you look, then the pain begins to rise again, represented by the brown line. And if the patient isn't careful to take another dose of medication, their pain will get too high and out of control. We call this getting behind the pain. This getting behind the pain and having the pain be at a high level is common and makes it much more difficult to get the pain under control. Now I've drawn the same curve and put in markers for taking the medication at a scheduled time. In this case, the patient's going to find that their pain level stays low and doesn't get too high and out of control. If they take it PRN as needed, it oftentimes gets too high and out of control. Once the pain has gotten that far along, it's very difficult to control. The patient oftentimes tries the medication and gives up because it doesn't seem to work. So that you can see, giving the medication on a scheduled basis turns out to be very important, and what we like to use a special idiom to say, it is the secret sauce. But wait, there is a second part to the secret sauce, another secret which will make all the difference in the world. Let me share that with you as well. The second part of the secret is to have the right dosage. The patient must take at least 2,000 milligrams a day and sometimes 3,000 milligrams a day. That is a safe dose of paracetamol. So what I like to do is use the 500 milligram tablets and have them take 2 tablets in the morning and 2 tablets in the evening. If they need a third dose, they can take 2 more at lunchtime. And they should do this on a regularly scheduled basis and not wait until they're feeling the pain at a high level. This strategy is a commonly used strategy by the rheumatologists, the specialists in joint pain here in our country. So stay away from that PRN dosage, please. Here is a graphic which summarizes what we've been saying about what is a safe dose and reminding you that there is a trick, which is timing as well. Topical diclofenac can be used also, and that one can definitely be used as needed, PRN. You have that in your formulary, so you may use that PRN with patients who are having difficulty with joint pain. Now let's talk just a little bit about acute injury, which is different than chronic pain. So here's a picture which shows an acute injury. These kinds of injuries are often in a younger patient, and consequently using an NSAID is much safer for them. NSAIDs used in older patients run the risk of ulcers, raising high blood pressure associated with heart attacks, and also can definitely affect the kidneys. But in younger patients with acute injuries, we don't usually have to be concerned about those issues. So think about the patient with pain. Is this an older patient or a younger patient? Will they need medication on a chronic basis or just a short-term basis? What's the right dose for them and how it should be timed? Well, that's it for today. Remember Psalms 119, 130, which says, "The unfolding of your word gives light and gives understanding to the simple." So keep reading your Bibles, praying for you. Talk to you again soon. Bye.